Broadcasting from the business capital of the world, this is the Podcast Business News Network.
And welcome back, everybody. It is one of the most misunderstood systems in the body. There's not a lot of talk about it. There's even not a lot of visuals of it, i.e., pictures, drawings, but it is so important in our bodies, and nobody really talks about it. I'm talking about the lymphatic system. It gets rid of toxins. I'm not qualified to go any deeper than that. She is. She spent the better part of 20 years holistically healing people through lymphatic drainage therapy and lots of other modalities. She has a place called the Healing Space where you can find tranquility, renewal, and healing. And it's located in Fairhaven, Massachusetts. And from there, she joins us today. Barbara, I want to make sure I get your name right. Cappadona joins us here in the program. How
That's
are you?
correct. Thank you very much.
Welcome. I've actually had lymphatic drainage massage, and we can get into the reason why. But even before we go there, this thing called the lymphatic system, what the heck does it do?
The lymphatic system is one of the most underappreciated systems of the body. People, as you said in your introduction, they have heard about it before. Everybody has heard about their lymph nodes. They have maybe tangentially heard about swollen lymph nodes and the need to, and how it affects your immune system and so forth. But they really don't understand how it functions and how, when it's not functioning optimally, how it can really impact your system. So it's the support system for all the other systems of the body. And when it's not functioning properly, it can make whatever you're going through feel even worse. And when it's when it's working really well, it can help you support yourself as you're going through. It can help if you are feeling crappy, pardon the word, but if you're not feeling as good as you would like to feel, working with the lymphatic system to optimize it can improve your overall health and your ability to manage whatever chronic conditions and many of us have. So it is, it does that by, one of its main functions is to act as the body's garbage disposal. So it's responsible for clearing the waste products that our cells produce out of our body efficiently. And it's something that can easily get congested and not work as well as we would like.
And when it gets mucked up, is that usually from traumas, injuries?
There are a variety of ways that our bodies become less optimized. When we come into this world, we're usually, the system's working pretty well, okay? Now, it's important to understand that the lymphatic system works in conjunction with the circulatory system. And the circulatory system consists of the heart, the arteries, the veins. So the heart pumps the blood out through the arteries into the body to nourish the cells. The cells are living organisms that produce waste products. Those waste products are then excreted into the system. The veins absorb the little particles and flush those through and move on. The larger particles are absorbed by the small lymphatic vessels that are throughout our body. There's virtually no area of our body where we do not find these small, very small lymphatic vessels. The only place you don't find them would be in the eyeballs and sections of the brain. So unlike the circulatory system that has its own pumping mechanism, which is the heart, the lymphatic system doesn't have that. It requires movement. So when our bodies become less active, okay, age is a really good example of how our systems can become less functioning, less optimized. Age, diet, stress, trauma, disease, surgeries, body mechanics, all of these can impact how well our system works. And people will say, well, I'm exercising all the time. Yes, and that, it helps a lot, but sometimes it gets to a point where it just can't. If you've got an injury, for instance, I work with a lot of people who are pre and post surgical. I work with a lot of people who are rehabbing after injuries. So the area swells and the tissue cannot return to normal. It doesn't return quickly. So working with the lymphatic system to help the lymphatic fluid remove those toxins and help the body get more blood flow to the area, more oxygen to the area, helps reduce pain and inflammation, and promotes faster healing. So I think I went a little further than what you asked, but
it's so important. That's what we need to talk about it. I find it amazing that by using, call it massage,
just it's loosely. Not, and that's the other thing I'm going to do right now. This is one of my pet peeves, because as it's becoming more well known in the general public, and I'm so part of what I've been doing for the last 16 years is educating not only my clients and the general public, but doctors when I go in to meet with them and talk to them about it, and recognizing that I just lost my train of thought. We were talking about
massage. It's not massage.
Yes. When they're talking to their clients, okay, their patients rather, and they recognize that this has value to their patients and their recovery. So they will I'm finding that more and more doctors are referring their patients out for lymphatic work. But what they're doing is they're telling their patients to go look for a lymphatic massage. It's a whole different animal. Massage, lymphatic work, they blend nicely together, but they're not the same thing. A massage therapist, even though I was trained as a massage therapist over 22 years ago, and I was taught at that time that the work that I did impacted the lymphatic system. It does, but not in the way that is effective in what I do as a lymph drainage therapist. The pressure in massage is much too heavy. When you're working with the lymphatic system, it's a very gentle, very subtle technique that almost feels like you're not doing anything to the person. It is deeply relaxing, but can produce some amazing responses in the body. So the touch that we use is no more than the weight of a dime on the body. It's a very repetitive touch. So we stretch ever so gently to a count of 3 and then release. So we're stretching over the same area, anywhere from 5 to 15 repetitions, always working towards the heart. So from the neck up, we work this way towards the heart. From the neck down, we work up towards the heart. So there's a very specific technique that requires very specific training in how to utilize it with the patient. So when I get calls from people all the time looking for lymphatic massage, and it's usually they find me after going through several other people, but they've been told this massage is what they need, and all it's really doing is creating, not that I'm putting massage down, I love massage, I still do massage, but people looking for lymphatic work are usually looking for it for very specific reasons, and they need a different technique in order to achieve those results.
When you're working along somebody's body with that light touch, really, what are you doing? Can you explain? It almost, I get a visual of like, you're just kind of moving it along, kind of yes. Throwing out the trash.
That's basically it. I'm moving and throwing out the trash. I'm helping the body remove the trash. As I explain it to clients, they're going to go probably into a really deep, relaxed state. And as they're in their state, into that, it almost is a deep meditative state, because because of my training, I'm also, my original training was in massage along with energy healing technique called modality called polarity therapy. So that's how I worked essentially for the first 7 or 8 years. And then I discovered lymphatic work, and it all just sort of blended together well. So the technique is, because it's so relaxing, you go into this state and you don't really understand what's going on. You're just sort of feeling these feelings in your body. I have clients tell me that as I'm working, I explain to people that, first of all, before they even get on the table, I go through this whole explanation of what it is, what's going to happen, and how their body may respond, because there are a number of different responses that this work can produce. For some people, they just go off into this state and they don't really notice or feel very much until they get off the table. And then you're just like, I just saw things. I saw colors, or I just got really deeply relaxed and everything sort of went away. And then for other people, their body is responding, they're hearing or feeling movement in their body. As I'm working, because these vessels are not, they work on a vacuum system. So I could be working up here, clearing your neck, and you may feel draining coming down from your head. You may feel a sensation of fluid coming up from your legs or from another part of your body. It's really, really funky the way it works. And people are very surprised when they're getting these different sensations, because it's not something that they've ever experienced before. So you may get a sensation of physically feeling fluid moving in your body. You may hear, a lot of times it's physically hearing gurgling coming from different body parts as I'm working, as the fluid is, as the vessels are opening up and the lymphatic fluid is moving through the system to the different areas where it needs to be cleared. So that's what's happening. What's happening is that as a therapist, we are trying to gently encourage those lymphatic vessels to open. There are the little flaps on the vessels themselves. So this technique moves that fluid through those vessels. So one flap goes up, fluid goes through, flap goes down, pressure forces the fluid through, other flap goes up. So it's this routine. And that's what this is doing. This technique is encouraging that gentle opening so that the fluid starts to move through your system.
Is it almost like, best analogy I come up with here, like a garden hose? You're kind of pushing it along,
Yeah.
Let's
Well,
say
the system, what I typically compare it to is like, canals and the locks, when you're pushing a ship through and the
sure.
canal goes, the lock goes up,
Yep.
fluid goes through, the flap of the chamber goes down, and then it just does this repetitive action to get the ship through the canal.
Yep.
So that's essentially what it's like.
Wow. Once you've moved it through the chambers, if you will, where does it go?
Okay, so there's a process. The lymphatic system you've got the lymphatic vessels, which are where it all starts, those tiny little vessels. That then moves through the next area of clearance, which are the lymph nodes. And you've got, in an adult human body, you've got approximately 750 to 800 nodes. Those nodes appear throughout the body, but primarily on the front. And on the front of the body, you're going to find much larger quantities collecting in the neck, in the axilla area, which is under the arms, in the abdominal area, and in the pelvic hip crease area. I call these the big four. And so I spend a lot of time clearing these areas because we want the nodes to open. We want the fluid to pass through those nodes for further clearance. And once they go through the nodes, they then pass through the lymphatic organs, which the main one is the spleen, and then you've got the liver and some others that we work with. Once it passes through those organs for clearance, what can be recycled is recycled. What is eliminated through the organs of elimination, which are the bladder, the bowel, the skin. So you're going to get rather graphic here. Pee, poop, sweat. Those are the 3 ways you're going to eliminate your waste products in your body.
And you won't even know it. It's not like you're gonna, oh, wait a minute, that looks different today. That must be right.
Exactly. Well, you're not going to know it if you're having work done after a session. I don't know if you experienced this when you had it, but it doesn't happen with every client, but sometimes it does. It produces, as I mentioned earlier, it increases lymphatic volume and blood volume. So it increases fluid in your body. So after a session, I will tell clients, one of the things that will probably happen is you may see changes in your bladder, bowel, and sweat function. You may be going to the bathroom more frequently, okay, urinating more frequently, not only because of the work that we've done that's increased volume in your bladder, but because I've been telling you after a session, it's really important to encourage this by staying really well hydrated. So we're telling people, even after a regular massage, you're encouraging clients to stay hydrated, but especially after lymphatic work, it's important that they continue to drink plenty of fluids, avoiding nicotine, alcohol, caffeine. Heavy, sugary, fatty foods is what I typically suggest that they do, at least for the first 24 to 48 hours if they can. It just makes the process easier on their body.
I had no idea that there were that many lymph nodes in our body. 600 something, I think you said.
No, 750 to 800.
Same thing.
Yeah.
There's a lot.
Yeah.
There's a lot more.
Well,
Well, coming from somebody like you, of course, you're going to know the number. We think I got two here, 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 here,
yeah.
here.
Yeah.
A
Well,
dozen.
the ones that usually swell on you, and that's what makes sense. But no, they're all over the body.
Incredible. Wow. I met somebody last year that was so passionate about the lymphatic system that she was working on a book to show pictures of the system.
Yeah.
There's no pictures. There's no anything.
Well, there are
Very few.
representations that have to be done with dye and imaging, and in the textbooks that I have for the work that I do, I have seen these. But you're right, it's not something that's, when you're showing the anatomy to a small child, you're not going to see the lymph system. It's not going to appear anywhere.
In her book, and she's in the process of compiling, it's a lot of work. Do you know where she's getting the pictures from? They're from the 1700s.
Yes, because they started doing work on that.
And it's more detailed, where it's almost as if here we are, 2024. We're like, let it go. Everybody knows and take it for granted. And you don't have, a lot of imagery, documentation. It's mind blowing.
I know it. As I said, it is the most underappreciated or least understood by the general public. And even, uh, I'm not saying that doctors aren't familiar with it, because obviously, as medical professionals, they have been trained and they've at least had classes in it. But it's a very superficial, unless they have gone on to specialize. It's a very short period of time that they are studying the lymphatic system. So they have a broad understanding, just as I had a broad understanding, and I'm not comparing the two in terms of education, but when I was studying to become a massage therapist and taking physiology and anatomy and studying the body, we talked about it, but I certainly didn't understand it in any particular way, other than it's affects the immune system, and if you get XYZ, you're screwed. So that's a lot of what happens with our doctors. They understand it, but they don't realize how this work can be effective with not just things like lymphedema, which is where it was really understood for benefiting, especially women who have had breast cancer and developed lymphedema post surgery. And that is something that has developed over multiple years of treating that with lymphatic work, but not just, usually when they're working, they're doing something much more extensive. When I'm working, I can work with lymphedema clients lymphedema, by the way, is staged like cancer, 0 to 4. So I can work with patients who are 0 to 1 with a diagnosis of lymphedema. That's fairly mild, and doesn't require bandaging, which is much more extensive. And that's a different level of education. And in Massachusetts, I can't do it as a massage therapist. I have to work in a medical environment. So at my age, I decided not to do that. But it's changed a lot because it's not just for lymphedema. It's not just for that kind of situation anymore. It can be utilized. I use it virtually in every session that I have with clients, regardless of what we're treating, because it is so effective.
Wow. Should anybody just out of nowhere say,
Yeah,
hey, you
I
know
get
what?
people all the time who I've, again, it's becoming much more fashionable to talk about it. You get a lot of influencers who are now out there promoting it, not fully understanding it, but they are promoting it. And so I get calls all the time. Oh, I've read about this. I've seen it. I think it might be helpful. I want to try it. And they come in and we talk, and I explain to them what's going on. And, even if you have nothing going on, it's an amazing session. It
I
just, it just brings you to a whole different level.
it's I felt much better after I had it. And, one of the reasons I did was, I've had a couple of minor surgeries here and there,
Yeah,
and I just felt that, after reading and learning about it, you know what, it's time to clean up a little bit, on a more holistic path. Um, it's amazing what's out there, and we don't talk about it. It's almost
I know.
herbal medicine. No, what do? We go to the doctor, put them on a pedestal, pop a pill, don't talk about the root cause, just deal with the symptoms, and then we go on our way. So glad we're talking about this today. And this is just this is the main modality that you offer in Fairhaven. But there's other things that you've got going on there. Prenatal massage, right? You mentioned,
Yes. Well, as I mentioned earlier, when I started, I trained as a holistic practitioner. I did a dual program in traditional massage therapy, including a wide variety of deep tissue techniques. And at the same time, I did my training in advanced training in polarity therapy. So from the very beginning, back in 2000, when I decided to pursue this and change careers, I I knew I needed to address the entire person. I had been doing massage personally for years before I even started as a training. So I was receiving as well as giving amateurly, and then doing it as an amateur, and then doing it as a professional. So I my focus was always on treating the person as in their totality, not just their physical issues, because when from my own experience, okay, my own personal health history, I know I've been dealing with chronic pain and back issues since I was 18. So I knew what it was like to live with chronic pain and how it affects your body. It's not just physically, it affects you emotionally, it affects you mentally. So there's always this tension in your body and this stress. So if you can, during a session, address all of that, address the tension that they're holding, not only in their physical body, but in their emotional and mental bodies, you can create real change. You can't, if you're just looking at the person, if you're trying to separate all of these out, there is no separation. We are one thing. We just like to think of this as these are separate entities. So when I work on trying to relax the entire person, the entire body, as to who they are. And so when I do traditional massages, I said, I do energy work. And as I always tell clients, it's part of what I am and what I do. So you're getting it regardless whether I'm doing a whole session or not. There's always energy work included. And I use a variety of tools in my session to create a deeper relaxation response for my clients. So I use hot stones, I use crystals, I use essential
wow.
oils. I've got a far infrared mat on the table. So this is really a totality of experience, not just one thing.
You have a lot, you have a full arsenal. And as
I
soon as you
do.
said,
I do.
yeah, it's great though. But also practical. Like some people can say, "Oh, I don't know about this energy thing." I'm not one of those people. Big believer, big believer. However, with the lymphatic drainage massage, it's obvious that you're working on somebody.
It works. That's why I fell in love with lymphatic work as passionately as I did, because it blends so well with the energy work. You're working with that I'll call it water based, but you're working in that medium, which lends itself really well to the energetic components of what I do. So it just sort of elevates the sessions.
Fairhaven, Massachusetts is where you're located. Obviously, you can't do anything virtual. Maybe
Well,
energy work, that.
I do. I From the very beginning, I've always offered, because of the energy training, I've always offered distance sessions for
Sure.
clients, energy sessions. And once I started learning lymphatic work, I recognized that I can actually do lymphatic work at a distance. Now, I've done this.
Oh.
I've done this in the past with a couple of clients. I don't do it all the time. It's most clients want to physically be here to be worked on, and I love doing that. But in some cases, I have done it at a distance because they either were too sick to come see me, or it was just more convenient at that particular time. They were too far away.
Wow.
So it's not something I do often. It is something that is possible to do, but not everybody wants to do it that way. And I appreciate that.
How do we find you?
Well, my website, the Healing Space, fairhaven.com, is the main way to find me. You get my address, phone number, website, email address, everything is there. So that anybody who has questions I'm more than happy to talk to anybody about lymphatic work, because as I said, I'm so passionate about it. And I really feel that it's important for the public to understand what it can and what it can't do. There are a lot of promises out there. There's a lot of information that I will get, people calling me and saying, will this help me lose weight? And I'm going, not really, honey. This isn't what it's meant to do. It might, but that's not what it's going to do. Yes, there is a technique that I can do to help reduce the visibility of cellulite, but it's a temporary action. It's not a permanent thing. It'll maybe last a day or two, maybe a week if you're lucky. So it's not something that it's not a cure-all. It's a really important tool in the toolbox, but it has its limitations just like everything else.
Just knowing that we're walking around with these toxins that we haven't released for whatever reason is all the more. We're out of time.
Using the word toxins because it's a loaded word.
Yeah,
it's waste.
It's waste.
We have
Thank
a
you.
lot of waste in our systems that are not being eliminated properly.
Thank you. Waste is the word. Barbara, fascinating talking with you. Thank you for reaffirming how important the lymphatic system is in our bodies, and learned a lot. Appreciate it today. Thanks for being here.
Thank you so much for having me. I appreciate being here too.
We'll be right back.
Are you looking for even more of the podcasts and hosts that you love? The Podcast Business News Network is proud to announce that you now have even more ways to listen live. Check out the MyTuner Radio, online radio box, and Simple Radio apps on iOS and Android, or find us online. Search for Business News Network on mytuner-radio.com, or search Podcast Business News Network on streama.com and onlineradiobox.com/US. Take your podcast on the go and don't miss a minute of the action.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.
For nearly 2,000 severely injured veterans, everyday life has become filled with barriers.
Day-to-day simple tasks can become pretty daunting.
I have to carry my chair up 2 flights of steps or have somebody do it for me.
What scares me the most is just the falling.
When I'm struggling with my house, I think, to have that one great barrier just knocked down, it's crucial.
Home for Our Troops is a wonderful nonprofit that builds a
mortgage-free, fully adaptive, handicap-accessible house.
And there's no catch.
It'll be our very first home.
that we've ever owned. This is a game changer.
This is where your life begins again.
We need you to join us in completing this important mission. Please visit hfotusa.org and help build homes and rebuild lives.
Because of you, everything's going to be okay.